Hi, I'm Elaine Berry. I'm one of the lactation consultants here at Owensboro Health, and I've had more than 30 years experience working with breastfeeding moms. So I'm here to share with you some of the top 10 reasons why you should breastfeed. And in your doctor's office, you may see this poster. It is from our marketing department, and it talks about the benefits and the power of breast milk, the best food for your baby. It's the perfect combination of both nutrition and those anti-infective antibodies that help build your baby's immune system. So that's the number one reason that most moms know about breastfeeding, is that it does build that stronger immune system. Your first milk is so powerful that every drop has millions of cells that help build your baby's immune system, helps coat your baby's tummy, and helps protect it against germs from the outside world. So it really helps in those first few months when the baby is more susceptible to more infections, because they need that immune system built. And because of that, there's several studies that have been shown that it also lowers the risk of SIDS. The latest study says that if a mom breastfeeds for at least 2 months, that they can reduce their risk of SIDS by 50%. So the longer you breastfeed, the better. Most of the studies that are done on breastfeeding are dose related, which means a little is good, more is better, and the longer you breastfeed, the better the benefits for both you and your baby. The American Academy of Pediatrics recommends, and most health organizations recommend, that a mom exclusively breastfeed for the first 6 months and then continue breastfeeding for at least a year with the addition of other foods and for longer. The American Academy of Pediatrics also recommends it for moms and for babies. They know that it helps reduce healthcare costs because there's less infections, less of all kinds of infections, but because your breast milk is so much easier to digest, there's less gas, less diarrhea, less constipation for a baby, so it helps them to digest it much easier. The bonding is better for both mom and baby. That's just a big benefit for both. And because when a mom breastfeeds, they have relaxing endorphins that helps relax a mom and helps her bond with her baby. It also helps increase the baby's IQ. So that's another big benefit that have other studies that have been shown that if a baby gets mom's own breast milk, they have higher IQ scores and cognitive skills even later in life. So there's much more benefits even later in life for the baby, for reduced cancer and for reduced diabetes and obesity, which is a really big one. Most moms know that it is more cost effective because it doesn't cost as much, but the cost savings for not just for one family can be $2,000 to $4,000 for a year, and it saves the nation $3 billion. And that's if moms all breastfeed for at least 6 months. Most moms also know about that it burns extra calories, so moms get back to their pre-pregnancy weight a lot quicker too. And it helps reduce their chance of getting breast cancer, ovarian cancer, uterine cancer. All those are less. And the longer you breastfeed, the better the benefits. Also for heart disease. The heart disease is the #1 killer of women. And so the longer you breastfeed, the less your chance, the more children you breastfeed, the less your chance of getting heart disease or dying of a heart attack later in life. But the #1 benefit that most moms have told me when I ask moms why they breastfeed, it is because it is much more convenient. The #1 reason is it's more convenient. The food is always ready. It's at the perfect consistency. It's got everything the baby needs at the right temperature. So I say it's the best fast food in 2 convenient locations. So when you need help, or if you are getting used to your baby learning to breastfeed, remember to come to our prenatal classes that we hold every month and our Breastfeeding Friends group that meets the 3rd Saturday of every month. You can bring your baby, weigh your baby. and just talk to other moms that are also breastfeeding, and we all learn from each other. Remember, we're there for you, and we look forward to seeing you when you come into the hospital.